to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Kathy Whaley. She is a hospitalist and palliative care physician. She wrote the Kevin MD article, Permission to Burn the Manual. Kathy, welcome to the show.
Thank you so much for having me. It's a wonderful opportunity to share.
We'll get into the article in a little bit, but first off, can you share your story and journey to where you are today?
Sure, absolutely. So I was born in Little Rock, Arkansas to a pediatrician father, and I knew from the beginning that I wanted to be a doctor. That was not a pressure point from my family. That was really my own drive. I was very fascinated by science and germs and all those good things. So very early on, that was a goal that I fixated on, and all of my expectations for myself were really driven for that goal. But then when I finished residency, immediately prior to starting fellowship, I really realized that this was not what I had thought it was going to be. And I think that's a very common sentiment that you hear medical professionals say is, this just wasn't what I thought it was going to be. And in large part, it was realizing that I had drastically become somebody I did not like. So I was experiencing burnout at that point. And I then went into palliative care fellowship, and that was a bit of a reset for me because the circumstances had changed. I was doing a different role. And so that helped a little bit. Then I went out into private hospitalist practice and helping a community hospital start a palliative care program. Again, that helped a little bit, but inevitably burnout always returned. It was like I would change the circumstance, and then given enough time, I was right back where I was. So the problem wasn't the places, the problem was me. So I finally landed in my current role, and I've been there for 4 years. And when I made the transition from my previous place of employment, it was largely, I was trying to renegotiate my contract, and I was trying to renegotiate it in a way that it would give me that reset I craved without changing jobs. And we could not come to terms with a negotiation that accomplished that. So I took a leadership position in another hospital that was enough of a departure from what I had been doing that it felt like the reset. But then 2 years later, right before the pandemic hit, I mean, I was just at rock bottom, absolutely rock bottom, where I realized I don't want to do this anymore. I don't want to be a doctor anymore. I will do anything but. And so it became this panicky drive to get out of medicine, like at all costs. What came from there was, I really thought I didn't have any other skills or really couldn't acquire any other skills because I always thought I'm a doctor, like this is what I've worked so hard for. But I became so desperate that I actually started studying real estate, which had always been something I was very interested in. And in the process of this, I actually encountered some physicians turned life coaches. And in listening to them, I just had these aha moments like, oh, this is what I'm missing. Like, this is what I need. So then I started being coached. Then I decided to go for coaching certification to offer it to other healthcare professionals. And so now I'm on this mission to try to say the things that I needed to hear 2 years ago when I was at rock bottom and just feeling like I was trapped and trying to claw my way out. And that's really how Permission to Burn Your Manual and some of the articles have come, is trying to say the things that people may need to hear in order to jostle themselves into realizing they have choices.
So I certainly want to hear what some of those things are. But before we get into that, let me ask you, you talked about in your story that you've had multiple episodes where you felt burnt out, you felt you're rock bottom, you said that you didn't like the person you had become. Paint us a picture of what exactly you felt during those lowest times.
Sure. So in general, I find as a healthcare professional, you learn to talk to yourself very negatively. So prior to starting medical training, I possessed self-compassion to some extent, and I was not all that perfectionistic. But over the course of training, I became much more impatient, much more perfectionistic, much less self-compassion, And then it's almost like I assumed this culture of medicine and I propagated it. So like looking back, I very much remember the moment that I, like me not beating myself up because I had missed a point of the history was horribly frowned upon by a surgery attending. Like this was when I was a med student. And I was sitting there saying, okay, this is my first rotation on third year, and I didn't know that the man only had one kidney. Okay. Well, because I didn't turn beet red and just like beat myself in front of the man, that was taken to mean that I didn't care. And so that actually became a huge issue in my surgery rotation. Like I had to have meetings. At the end, they gave me a C saying that, maybe this wasn't the right fit. Now, I wasn't shooting for surgery, but that was one of those moments where I really realized that it's not okay to mess up. It's not even okay to mess up when you're learning. You are expected to be perfect, right? So then I start striving for that. And then when I'm an upper level resident, I expect that for my trainees, right? So what I learned, what I became, is what I taught others to learn and become. And that's disappointing.
All right, so let's talk more about your Kevin MD article. It's titled Permission to Burn a Manual. Now, for those that didn't get a chance to read your article, can you just walk my audience through it and share the story of why you decided to write it?
Sure. So the manual is a very common thing that's discussed in the context of life coaching. The manual is most often referenced in terms of other people. So we have an expectation of how our spouse behaves, and we have a list of shoulds, like you should have taken the trash out when I asked, et cetera. So it's basically a book that paints the expectations and how we sort of judge and value others. But for me, when the manual came up in learning, it really sort of hit me like a thunderclap of, oh my God, I have a manual for myself and it's a toxic manual and it's holding me back and I need to burn this thing. Like bonfire, burn it like the bras. And so I had been sort of pondering the manual, and then I also happened to see an interview, a very long interview with Dr. Jill Bolte Taylor. And she's the neuroanatomist that had a hemorrhagic stroke in her late 30s and her whole process through the stroke, right? And so as I was reading it, I saw so many similarities between her stroke recovery and what path and journey I was on, realizing that I was really harnessing neuroplasticity to retrain my brain and sort of let go of the things that weren't serving me, but really cultivate circuits in my brain and thoughts and ideas that were serving for me and that also help me enjoy today and not constantly looking for how much gap, how long it is until I've accomplished something. So her book is a lot about sort of right brain, left brain. And I would say that from reading her book, I really realized like how left brain dominant I was and how much medical training only strengthened that. And so it really sort of cut me off from parts of creativity and big picture. It became very data driven. And unfortunately, I really just didn't know how to be that way at work and turn it off and be different at home. It just became pervasive. Burning the manual, it really became realizing that there are infinite possibilities, right? That I could do and be anything, but that I was the one holding me back because I had this manual, which was based on being a doctor and all the things that I had done to try to achieve that point. And if doctor is written in big, bold letters at the top, there wasn't room for anything else. So in order to sort of reinvent myself, have a Phoenix rising moment, I had to burn it first. I had to say, like, I don't have to have this anymore. It's optional.
So we talk about burning the manual proverbially, as you said, but what are some specific techniques? Tell me a little bit about that journey where you burned a manual. What are some specific things that you were coached about and some specific things that you did?
Right. So I definitely, one of those things would be pursuing real estate. Like, I now have a real estate company that's very small, but that we're running rentals and that's doing very well. In the past, I always told myself that I only knew how to be a doctor And I also told myself that I shouldn't do anything else but be a doctor because I had worked so long for it. I had a lot of limiting beliefs about what my capabilities were. I also always told myself that there just wasn't enough time to do anything else. And I mean, there is a finite amount of time, but when you sort of take control of the mental drama that you have, you find that there's a lot more time because you quit spinning your wheels. So that was certainly one of them. The life coaching was another part of it, realizing that I didn't have to be a doctor forever. Now I'm actually happier practicing now than I have ever been. I find a tremendous amount of satisfaction and enjoyment from going. But I also realized that I don't really know a healthcare professional that isn't where I was 2 years ago, and that doesn't really need help sort of digging out of the hole and realizing their potential. And probably the biggest thing about burning the manual was really like, instead of looking to the evidence from the past to decide what I was capable of, because I think that's what we often do. It's like, I know how to cure this because I learned how to be a doctor or whatever, right? So instead of deciding what I was capable of based on the past, I decided, what do I want to be capable of in the future? And that's what I set out to learn. That's what I set out to create. I mean, if there's one thing that healthcare professionals are good at, it's learning, but in my mind, I was just a doctor.
And I think that you've hit on one of the themes that I always try to promote on this show and on my blog, is that physicians are more than their degrees, right? And exactly as you just said, there are a lot of physicians who are now in a place you were 2 to 3 years ago. Now, you're speaking to some of those physicians on this podcast, so
yes,
I'm sure they're motivated by your story. Tell me what kind of advice that you have for them in terms of burning their proverbial manuals.
So I think when you've experienced trauma, like many physicians have over the last 2 years, we sort of short circuit our imagination and our ability to dream. So if they can take one tiny step every day that is towards a dream, something new that's not based in the past, that's just something that fills their cup, I think that really will move the needle. Something I did, for example, I never have been write things. I've never been a podcaster. But when I felt like I had something to share, I was just like, well, I am now, right? So I wrote you articles, and I recently started a podcast called Permission to Burn Your Manual to say those things. And so if there's something that they really feel a mission towards, or something that's a craving or a dream that they've really wanted to do, take one small step towards it, right? Because those one small steps add up to massive action over time. And it can be extremely overwhelming, but all you've got to ask yourself is, do I have a strong why for why I want to do this? And what's one thing I could do today that moves the needle in that direction? Because the tiniest movement of the needle can translate to huge change.
Now, you're talking to an audience on Kevin MDN on this podcast, which mostly agrees with what you say. I say this all the time, in that physicians need a passion, sometimes outside of clinical medicine. But stepping outside our world, what's the general response that you get to your story? Do you have physicians who say, why are you focusing on these other things? You should be 100% focused on patient care. You're not a real doctor by doing this. Do you get that kind of pushback when you share your story?
So I do on occasion. And I usually tell them, try it. Try listening to my podcast. Try reading an article. Because overwhelmingly, when someone has come at me with this has nothing to do with being a doctor, I don't understand why. Doctor is just a role. But in that role, I want to serve. I want to help people be better. I want to help people have quality of life. And that is no different than what I'm doing now. It's just that I have a different title. And this title, I'm life coach, physician life coach, right? And so overwhelmingly, when someone has said that to me, I don't see what this has to do. I'm like, go listen to my first episode of my podcast. And what I get in response is usually, okay, I get it. I've had some people say that they think that this sort of work is essential to the survival of the profession. So I wouldn't knock it until you've explored it. And I do think that there are a lot of people who are in so much pain, they have so many pain points that they have a hard time even considering that it could be better
Mm-hmm.
because they've just sort of given up. And so I'm here to say, no, it absolutely can get better. I had given up too. Like I really had given up and I thought, oh my gosh, if I have to live like this until retirement, like I just, it made me want to vomit. I've done the work. It's actually simple work. It just requires your effort.
Mm-hmm.
But everybody is more than just a doctor. Their authentic selves is enough. They don't have to make themselves into anything. They just need to let themselves out.
We're talking to Kathy Whaley. She is a hospitalist and palliative care physician. She wrote the Kevin MD article, Permission to Burn the Manual. Kathy, what's something that you know now that you wish you knew back before you started this journey?
I wish I had known that contorting myself into this person that I thought I had to be to work in medicine was a lie. Mm-hmm. It was a false choice. Would it have been me going against the norm to have maintained my own sense of self-compassion and let go of the perfectionism and all of those things? Absolutely. It might not have been the norm, but it was still a choice I made back then. And if I had a do-over, I would not necessarily choose that for myself again, though it did put me on this journey and I've had a lot of wonderful experiences. But if I could talk to somebody who has started training, I would make it clear that it's not an either or choice. You don't have to be the person they're going to try to make you in order to survive in healthcare. You can just be your authentic self and it'll be okay.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, I would say, I think healthcare professionals have been waiting for the system to change so that we could change, so that we could feel better. We're constantly talking about how the system is not working. And I think all of that's true. But I find also a common theme of we've all felt really alone because when we talk to our peers, we talk about the system, but we don't talk about our personal pain points. So I think it's really time to start talking about it beyond the system. How is this affecting me as a person? And how do I recover what I've lost? And so if someone can really start shaking that off and doing that work, we as the profession are going to change, right? Because right now we've just been behaving like the perfect person that is in this dysfunctional system. They don't have to change so long as we keep being the person that works in that system. So if we'll shake ourselves off and help ourselves recover and start talking about the personal pain points, I think there is potential for the system to change. But waiting for the system to change first, I think would just result in the profession dying on the vine. I got tired of waiting.
Kathy, thank you so much for sharing your story, time, and insight. And thanks again for being on the show.
Thank you so much. I appreciate your time.